there's several types of people. You have people who are under 65 and are on Medicare due to some kind of disability, or the people who come onto Medicare at age 65. Those are some of our requests, but most of the requests we get are actually from the people who are on Medicare, have been on Medicare, made many decisions about their Medicare, Medicare Part D, Medicare Supplement, Medicare Advantage plans. They've made decisions, and yet they're still not sure, they're still not comfortable with what they've done. Oftentimes they've had incomplete information, sometimes they've even been outright misled. So what we try to do is clarify and simplify the massive amounts of information that everyone has into actionable steps that you can feel confident in that you've made the right decisions. So Medicare basically, for anyone who would listen to me, what I would tell you to do is, if you've been on Medicare for a while, just don't worry about what's happened in the past. What we're going to do is we're going to talk about Medicare as if you just got dropped into the world and they said, now you have Medicare, this is going to be your health insurance. And we're going to talk about the best things to do from there, okay? So you're going to have, basically, when you come onto Medicare, you're going to have two options. And that's, and the first choice you're going to have to make is between traditional Medicare, which is also known as Medicare Parts A and B, or Medicare Advantage plans, which is a privatized Medicare plan. That's where Medicare has kind of outsourced the insurance portion of Medicare to private insurance companies. So let's go through traditional Medicare and Medicare Advantage. Traditional Medicare, Medicare Part A and B, the difference in the parts is Part A covers, for all intents and purposes, simplicity, Part A covers anything done on an inpatient basis. Part B covers anything done on an outpatient. A and B together, inpatient, outpatient, there's no Martian coverage or anything like that. I think we're taken care of. So, and then, so you put those together, and that's been traditional Medicare. So your parents, your grandparents, ever since 1966 when Medicare started, there's traditional A and B. Recently, in the last decade, they've started the Medicare Advantage plans, or enhanced the Medicare Advantage plans, where private insurance companies, the Blue Cross Blue Shield, Cigna, and thousands and thousands of them, they're able to write their own plan for you. And then Medicare, if you enroll in their plan, they offer it in your area, because they can choose what areas they offer it in. If they offer it in your area, you can enroll in their plan, and Medicare will pay them a certain amount of money every month for you being in the plan. They'll take that as the premium. They can also charge you an additional premium that you'll have to look at. And they'll take that, and they'll be your primary insurance coverage for inpatient and outpatient services. So the question you got to say is, do I want inpatient? Do I want Medicare A and B, inpatient, outpatient, or do I want a private Medicare Advantage plan? So the one thing you have to make sure you don't ever look at is, do not compare, and oftentimes Medicare Advantage salespeople will teach you to take to compare the Medicare Advantage plan with a Medicare Supplement plan. And it's a complete apples to oranges comparison. It's like, which would you have, an apple or an elephant? It's two different things. You can't say, okay, well, this elephant costs more than the apple, so the elephant's not good. It's two different things. The more accurate comparison, and actually by law, the comparison is Medicare Advantage program has to be by law, the actuarial equivalent. Go get a team of lawyers, figure out what that is. I can explain it to you as well. But the actuarial equivalent of Medicare A and B. Basically what actuarial equivalent means, if you have 1 million people and they all signed up for it at the end, it would cost the same amount of claims to the insurance company, using the law of big numbers. So it has to be at least the same as that. They can add different, sometimes they add a little something else to it, like you have a MAPD plan that has the Part D plan in it, so it's all in one plan, or instead of two separate policies, but your experiences are the same. So the first thing you have to do is decide between those. Now, I recommend to everyone, because if I make a recommendation to you, it would have to be the same thing I would say I would do to my mother or my grandmother, who are both on Medicare right now, and I'm going to tell you where they are. I recommend they all go with traditional Medicare. Now, a lot of my friends in the insurance business and these big insurance companies, don't like you saying that, because they make their money. Insurance companies make a lot more money when Medicare has outsourced all of their services to this company. However, when they get that, then they're control your health care. even though the benefits, and they can move around all the pieces, deductibles, co-payments, maximum out-of-pocket stop losses, co-pays on drugs, step-down therapies, all these things. They can move them all around as much as they want. But in the bottom line, they're all the same. Except there's restrictions that Medicare Advantage companies can put on you that traditional Medicare doesn't. Traditional Medicare, of course, you have any doctor who is in the Medicare network in the entire country. You can go anywhere. You don't have to make an appointment. You don't have to get a referral. You have to make an appointment, excuse me. You don't have to get a referral. You don't have to get an approval from your insurance company. And they don't have to come back and ask your insurance company if they can treat you in a certain way that they want to. They follow the Medicare guidelines. They treat you. If it's approved by Medicare, then Medicare will pay. When you go to the private insurance company, it's much more like the health insurance, So basically, A and B is like the insurance of old. It's like the insurance that my parents used to enjoy before they were even on Medicare. Where your doctors got to make decisions rather than your insurance company. Where you got to go to the doctor you choose. And a lot of people say, I like my doctor, but we take out insurance for what might happen to us. And if you get some serious disease like cancer, have a stroke or something like that, there are places that you are in this country where you are 3 times more likely to survive and become a cancer survivor than the local place in your town that you want to go to. So isn't it better when you buy insurance to buy a policy that allows you the freedom to go wherever you want to go, anywhere in the country? And if I want to go to MD Anderson down in Houston, it's a great cancer center treatment, Cancer Centers of America. If I want to go to the Mayo Clinic for special conditions, if I want to go to those places, I call and make an appointment, and my insurance company gets the bill, or Medicare gets a bill and acts like this. If I have a Medicare Advantage plan, well, now, even though the benefits are the same, my choice of providers, my choice of where I can go, and how those doctors can actually treat me differs. And we can get really into the weeds of all of these things, and we can tell you all, how things can change mid-year, how you're locked in from year to year. You can't get out if you make a bad decision, or if your doctor says mid-year, I'm not going to accept this insurance anymore, you're still locked into that plan until the end of the year. You have no freedom to go back to traditional Medicare, where you have options. I mean, there's a lot of things, and we can go really deep in the weeds, and maybe we'll do that in another video or talk that we have sometime. But for this purpose, just remember that Medicare A and B is go to any doctor, any hospital, anywhere in the country, as long as they're a Medicare provider, which 98-point-something% of doctors out there participate in the Medicare program. And Medicare Advantage plans are privatized, actuarial equivalent of A and B, but they often have network provider restrictions. And they can often restrict how your doctor can treat you if you're going to be paid. So a lot of people end up paying out of pocket or not getting the care that they could have gotten otherwise. I tell everyone, just like for me, for anyone, it's always true that that it's better to have options than to not have options, especially when it comes to your health care. We take out insurance because of what might happen, not because of the way our world, if my doctor's in the network, the doctor you have may not cover what's happening down the road. And if it's just what you're doing now, you probably are okay, right? I can afford to go to my doctor once every 6 months like I go to now. I don't need to pay insurance premiums, but we don't take out insurance. We take out insurance for things that could happen later that are beyond our capacity to pay, things like that. So we got to be very careful. So I recommend 100 out of 100 people go with traditional Medicare rather than Medicare Advantage. Once you have Medicare A and B, and you've enrolled in that, then you have to make it. There's some other things you're going to need. Do I take out a Medicare supplemental insurance or not? Medicare supplemental, basically all insurance has little holes in it. They're called deductibles, co-pays. They got little gaps. Medicare supplemental insurance just comes in. It's designed exactly with the Medicare gaps to fill it in just like a key into a lock. And you can get one that doesn't cover this gap, one that covers all of them, things like that. Do you want to do that? There's a lot of reasons you should. My grandmother, both of my parents are on Medicare supplement insurance and Medicare Part A and B. And then, of course, you're going to want a Medicare Part D drug plan. Medicare Part D, just real quickly, with everyone asks, what are the best Medicare supplemental plans? Everyone's situation is different. There's three, but for the most part, there's 10 available plans in the country. They're all standardized in 47 states, everywhere except Massachusetts, Wisconsin, and Minnesota. You have 10 available plans. They're lettered A through N. When there's a few of them missing that got grandfathered out or whatever, but and you can choose those. If you want me to shorten your curve, F or G, pick one of those two. For 99% of the people we talk to, if you're in Pennsylvania, look at C, which is just like the F, but C or the F is almost the same in Pennsylvania because of a law they have about something. But those are the two choices you would look at, F or G. F, 100% coverage of everything Medicare doesn't cover. So as long as Medicare pays a penny on a charge between, so you can go to inpatient, outpatient, you can go to any doctor, any hospital, anywhere in the country, and as long as Medicare approves a penny on a charge, with Medicare and your Medicare Supplement Plan F from any company, it'll pay 100% of every charge. So whether your bill is $5 or $5 million, you'll never have to pay a penny except your monthly premium that you pay for that. And that's what most people like, that ability, if you're on, like most of our clients who are on a fixed income, that ability to take that comfortable monthly premium, put that in, budget it, and know no matter what my healthcare expenses are, I can go anywhere, I can get any treatment in the healthcare system, and I don't have to worry about it. If that's whatever that premium is, I get my check every month, I get my income every month, this is a line item off of it, and now I have the peace of mind knowing I can go anywhere. The other plan, that's Plan F. Plan G is the same, but except there's a $147 outpatient deductible at the beginning of every year that Medicare Part B charges, and that's not picked up by the supplement. Oftentimes you can save $300 a year in premium and pay the $147 yourself. There might be some administrative hassles, up to you to decide. That's why Medigap360.com is here, and our team of qualified agents will walk every person through, spend as long as it takes with each person to make you feel 100% comfortable, making the right decision for you and your family. And again, we're also not tied to any insurance company. We represent just about every one of them out there that has anything to offer our clients, and we compile all and find the best rate and the best plan benefits for you, because we work for our clients. We do not work for the insurance companies, and we stand by you for life. We're not going to give you the company line. I mean, we can say it like that. Another thing you're going to do is you're going to want to get a Medicare Part D plan, and that's, back in, I think it was 2005, 2006, they started rolling out the Medicare Part D program. It's easy to kind of remember Part D for prescription drug. That's how most people remember it. But Medicare Part D covers prescription drugs. And before that, there was nothing available for seniors to pay for their drugs. They did it on the same model as Medicare Advantage in that they pay private insurance companies to have that. But it's a standalone plan that you have outside of your Medicare, traditional Medicare or Medicare supplement, and you get it on your own. There's amazing tools at Medigap360/Part D or just at Medicare.gov to help you compare all the plans out there and find the best. I will say this caveat. Whenever we help someone with a Medicare Part D plan, we tell them this: you are choosing between bad options. The way, with as many pharmaceuticals out there and the way the companies work and all of this, they devise all the plans. They're all different. They all have what's called formulas. We'll cover this. We won't cover that. We might cover this. And then they they price their plans accordingly based on what they'll do. Sometimes they'll cover your drug, but only if you've eliminated 3 other drugs and went through a bureaucratic process where your doctor signed 4 forms to get you the drug that you're already on. There's a lot of problems with it. But you know what? What I say is go find the best thing possible. Go find, put in your drugs into the tools, put in the medications you take, think about risks that you might have, compare all plans. There's great comparison tools out there. Find what's best for you. So, and then deal with the headaches. I mean, that's just what you're going to have to do. And I don't endorse any Medicare Part D plan. I just know it's better to have something to pay for your drugs than to not. Now, what I do love and what I will stand behind and tell you you're going to love is traditional Medicare, Parts A and B, and a Medicare supplement, where you can go to any doctor, any hospital that accepts Medicare anywhere in the country. Whether your bills are $5, $5 million, you have the right supplement plan. You never have to pay a penny on medical expenses. Now that is, I mean, I've been licensed insurance agent since 1997. My father started what was originally Todd Insurance Agency that has become Medigap 360 back in 1984. And any client who's had traditional Medicare with Medicare supplement has always been very, very happy with it. We've never, I mean, there's not many products out there that are perfect, and this is one that really is. Now, caveat, of course, perfect. Well, if I want something that's not approved by Medicare, you want an experimental surgery, you want something that's not approved by Medicare. You want a facelift. I want to look younger again. I got too many wrinkles. You want something like that. Of course, Medicare doesn't approve those things. Experimental surgery is not approved by the FDA yet. Those kind of things, of course, will not be covered. It's not everything you want it to be, but on Medicare approved inpatient and outpatient expenses, it covers you with the right Medicare, with Medicare A and B, and the right Medicare supplement. You can rest assured that you can go anywhere and never have to pay a penny. And so that's my advice. That's everything I have. That's my best stuff. I hope that helps whoever's listening.